I'm Dr. Mike Milligan. I'm here with Dr. Kim Kutsch from Albany, Oregon, developer of CariFree. Kim, thanks so much for being with us.
Hey, thanks, Mike. It's a pleasure to be here with you today.
Wonderful. Well, Kim, tell us an update on CariFree, and now you're into behavior modification to help those patients actually change their behaviors so that they really get the total benefits of your products.
Yeah, well, you know, Mike, I started on this journey probably 12 or 13 years ago, and I was really frustrated that patients were doing everything that I had been trained to tell them to do.
Right.
I was doing everything I'd been trained, and they continued to get tooth decay.
Right.
And so I really went about trying to figure out a better way to do that.
And you did.
And I did, yes, and it does work.
And we all in dentistry and patients around the world, thank you for that.
Oh, well, you know, thank you for sharing that with me, because I tell you, it's why I do what I do,
right.
Trying to, you know, end the suffering from this disease.
Right.
But, you know, we worked on diagnostic models, you know, risk assessment based care, helped develop a biometric for the disease, right. And then started working on products and therapeutic strategies that would be effective for patients.
Right.
The last piece of the puzzle for me was they needed to maybe make a behavioral change in their life to become healthy.
Yeah.
Like I could hand them the best rinse that I could conceive of,
right.
And if they wouldn't go home and use it and incorporate it and make it part of their habit,
right.
We wouldn't get any effect out of that. Right. So, or if they needed to change their diet or change their home care behavior. So really the last piece of the puzzle for me was I didn't have those skills. As dentists and hygienists, we're not trained to help somebody make a behavioral change.
Right. So let's back up just a second before we get into that final piece. Let's talk about the earlier pieces. So you learned that pH was a significant factor in allowing the pathogenic bacteria to thrive or not.
Yeah.
So just briefly touch on that for me.
This is really, I mean, dental caries, we always think of it as being a disease of mutans streptococci and lactobacillus. That's what we were taught.
Right.
But at the end of the day, this disease is really a biofilm disease with multiple pathogens, and it results from prolonged periods of low pH in the mouth, which result in net mineral loss. And so you have these bacteria, either too many bacteria or they're behaving badly, creating these long periods of low pH, which dissolves the calcium and phosphate out of the teeth.
Right.
So it's really a disease of pH.
Disease of pH. So then you develop products to help us control that pH.
Yep.
CariFree.
Right.
Okay. And extremely effective.
Right.
The problem was that to get the patients to continue to use because we've experienced that in our office. We've had many people use it. Fantastic results we're seeing, and then they'd go off and stop using it.
Right. It's like I don't need it anymore.
Now the final piece of the puzzle is
trying to get them to see this as a long or a sustainable behavioral change, right? A lifelong change.
Right.
So I can get somebody to change their behavior as a dentist in the short term, but like 6 months or 9 months from now, we're back to square one because they did it for a month and then they quit.
Yeah.
And so it's really understanding what does it take, how can I help that person sustain that behavioral change in their life, and that really comes down to wellness coaching. Those are specific skills and communication tools that exist. We just were never trained to do that.
So how do you help us with that? Help us again. You've helped us with the pH research. You've helped us with the products. Well, what do we do to help? Because we know it works.
Right. I have to tell you, Mike, the wellness coaching that I do in my practice has a huge impact on patients, and it's made me much more successful in terms of helping them create an outcome for themselves. Right. And like I did with dental caries, I went back and just started studying everything I could get my hands on to learn about this disease. I did the same thing with wellness coaching.
Wow.
And so I spent 3 years studying wellness coaching, reading every book I could find, and I enrolled. I found a wellness coach who's world recognized. She happens to be in Portland, Oregon, Ferocia Knight, and I went through Ferocia's entire program and became a certified coach. Since I've done that, Ferocia has a huge interest in helping professions. She's worked with a lot of oncologists, plastic surgeons, etc., in the Portland area.
We videoed Ferocia yesterday.
Yeah, and so you know what she's been up to. She's an amazing individual, but she's redesigning coaching and the coaching session to create a model for dentistry that you and I can implement in, let's say, 4 or 5 minutes.
Right.
We don't have the luxury of an hour to coach somebody, right, in our practice. That our system just isn't set up for that.
No.
But instead of having the normal conversation we're having for 4 or 5 minutes, let's have a coaching conversation instead. Let's just change the conversation so that it's more effective. Exactly. And so she's created this model. I have to tell you, it's easier to implement. I mean, you have the time. It's easy to implement. You just have to learn the skills, and it's incredibly effective.
And how do you learn those skills?
Contact us.
Okay.
Ferocia and I are actually working together right at the moment to create some workshops starting in 2014 for entire dental teams. It's our vision that not just the dentist or the hygienist, but the entire office should have the skill set.
Wonderful.
Just change the entire landscape of the office so that anybody in the practice could talk to the patient in that 3 or 4 or 5 minute conversation and help continue to move them, continue to coach them, to help them.
Fabulous. So we'll get to the contact information in a minute.
Right.
But first, any other things you'd like to tell us before we close?
No, I think that pretty well covers it. I would say the one thing in the last year that's really developed that we all as practitioners need to be aware of, we're making more and more discoveries in terms of how genetics play a role in dental caries, which we weren't really, I think, didn't have that much information about. And there have been at least 10 or 12 papers published in the last 2 years identifying very specific genes that correlate to risk factors for dental caries. So as we're dealing with our patients and we look at the normal risk factors and we can't seem to get any result, it may be that we're dealing with a genetic issue and we just need to...
Any genetic tests yet?
Not yet. There will be. I think there will be a point in time as we identify these specific genes and associations that we'll be able to develop some tests for that. Okay. But that's a little ways off yet. Okay. But if we can just identify patterns for the disease, we can have a better opportunity to help the patient.
Really help them a lot. Yeah. How do we get in touch with you now, Kim?
Well, you can email me at kimkutsch@aol.com.
Okay.
And you can contact CariFree, CariFree.com as well. And then
CariFree.com.
Okay. You can contact me through CariFree as well. Okay. And actually, you can find out about the coaching programs that Ferocia and I are going to do, kind of independent of CariFree, but certainly we want to make those available to everybody.
Okay, fantastic. Kim, thank you so much
for
being with us.
Thanks for being here. Yeah, I appreciate it.
Okay.